Now, COVID-19 has killed more than 250,000 people, and millions more have been infected from all walks of life. But in countries like the United States, it's those from ethnic minorities and the poorest in society that have been hit the hardest. There's always been inequality, but has the coronavirus exposed just how bad it is? Here's Adam Pletz.
It is the great equalizer. I don't care how smart, how rich, how powerful you think you are.
It's certainly true that anybody and everybody can catch the coronavirus. Politicians, Hollywood stars and royalty have fallen ill. But it appears COVID-19 is taking a disproportionate toll on many underprivileged groups, among them low-income earners and ethnic minorities. Analysis of data from 38 states in the US shows that Black Americans are more than twice as likely to die than other groups. And many don't feel they're getting the support they need.
We need more help right here with the sanitizing, the Lysol, and we do have Black-owned businesses who are helping, but we need the commissioners to come to the community and really pay attention to us. I feel we're left out.
Diseases nearly always reveal socioeconomic disparity, and the economic crisis that the coronavirus has caused will only compound the effects on the most vulnerable.
Esto, según dicen, que está por el mes de julio. Hasta ese entonces no sé qué hacer. Sobrevivo por las fundaciones que te regalan alimentos.
The coronavirus may have exposed inequality across the US and other countries. But as economies falter and low-income earners are the first to suffer, might it also widen the gap between the haves and have-nots? Adam Pletz, The Newsmakers.
Well, joining me now is Eric Adams. He's the president of the Borough of Brooklyn in New York, the first African-American to hold the position. And in Princeton, New Jersey is William Rodgers. He's a public policy professor and chief economist at the Eldridge Center at Rutgers University. He's recently been appointed to the New Jersey Governor's Restart and Recovery Commission. Gentlemen, really good to have you both on the Newsmakers. Eric Adams, let me start with you. Is it right to say that COVID-19, this horrible virus, has exposed the inequality and the divisions within American society?
Yes, it has, and it's clear. And we should understand that COVID virus was a crisis, but when a crisis is laid on top of pre-existing disparities and pre-existing systems that are inadequate, that crisis turns into a tragedy. And we saw on every level of how we're running cities in America that we've basically been overlooking some of the real issues that are not addressing the underlying reasons of poverty, to help disparities and other very important issues. So we failed to, number one, properly manage our assets, distribute them in a equitable fashion, and most importantly, in real time. And the fallout was Black and brown and poor people across the country were impacted because of that.
William Rodgers, is it similar to what happened with Hurricane Katrina, where the fragility of the system and the inequality is laid bare when the poorest tend to live in the neighborhoods where they are most fragile, and they're going to be hardest hit whenever a catastrophe hits, whether that is an earthquake, whether that's a hurricane, or whether that's a deadly virus?
Yeah, most definitely. Katrina, and particularly the images from Katrina, just telegraph that message right in its barest sense. But the challenge right now is that, along with lower income and communities of color being hit, this virus is transcending race. It's transcending income. For example, just the other day, there was a report coming out of Prince George's County. It's outside of Washington, D.C. It's one of the sort of the wealthiest, known for being one of the wealthiest African-American communities in the United States. And you're even seeing higher incidences of of infection and death in that community. So just having a good paycheck or having wealth doesn't necessarily insulate you. And another aspect that's happened with this pandemic is it's disproportionately, as the president of his council has said, it's fallen on people of color in their communities. It has also moved up the income scale. And it's also moved out to the suburbs, right? In New Jersey, I've worked with the United Nations, the United Way of Northern New Jersey, and we created this concept called ALICE a number of years ago, back in 2010, right after the Great Recession. And ALICE stands for Asset Limited, Income Constrained, and Employed. And what it really is capturing those New Jerseyans, and we've done this in 18 other states throughout the U.S., it's capturing those Americans who live or at or below the amount of money it costs to survive in their community. And what we found for New Jersey, we're to New York City and to New York State, we're the second highest incidence of COVID. But we found that basically, you need between $40,000 and $70,000 a year just to make ends meet. And what we also found is that during this period of prosperity from 2010 to 2018, 2019, the fraction of our population of households that are ALICE actually went up. You would expect it should go down in a time of prosperity. So the legacy of weakening unions, the legacy of not raising the minimum wage, the legacy of discrimination, these have always been there, and COVID just has begun to really, to manifest and expose that.
Eric Adams, when people say this is the great leveler, it's affecting us all, do you accept that?
No, not at all. The virus does not discriminate on who actually get COVID-19. Our policies are discriminatory. We need to be clear on that. And one of the best examples is what happened in New York City and what happened across the entire country. We divided New York City into two groups. One group was called non-essential employees. They were allowed to stay home, shelter in place. They were allowed to practice social distancing and receive face coverings. Then we divided another group we called essential employees. Over 70% of them were Black and brown and poor and immigrants. We were told them you couldn't shelter in place by the nature of your job, that you would not be able to practice social distancing, and we're not going to give you face covering. So you were going to catch COVID-19, you were going to take it home to your family, which several generations was living in the same household. So this was one of the greatest experiments in my belief since the Tuskegee experiment. We put Black and brown people in a very dangerous environment, made them run our cities, make sure that their supermarkets were filled, make sure they drove our Uber Eats to our home while they were in harm's way. And then when they went to the hospitals for testing, we said, no, we're not going to test you. We're going to send you back home, and you are going to infect your family. And that is why today I released a letter for the U.S. Justice Department, the Department of Justice, to investigate the potentiality of civil rights violations on Black and brown people, not only in New York, but across the entire country.
It's interesting you say that, right? And let me then pose this to William. William, I'm very cautious about seeing something on social media and then extrapolating from it and sort of developing a grand theory from it. But that being said, I've seen things on social media where there are people of color getting beaten up by policemen in New York, and then presumably others who are wealthier, whiter, sitting in parks, getting face masks handed out to them, right? So it seems as if in terms of policing as well, there's two sets of laws for people. Is that something you would accept?
It's a concern I have. As was mentioned in the lead-in, I've just been appointed by the governor to serve on his 18-member commission to help him and help guide him in reopening the economy, the New Jersey economy, and the regional economy. And one of the big things I am concerned about is policies that appear to be race neutral or ethnic neutral or gender neutral, but because of how we live and where we're concentrated, or because of what our zip code is, those policies get handed out in differential ways. I have a piece that just was published by The Conversation this morning that takes on this very issue that the borough president just mentioned. And going forward, as we reopen, it's not even a conversation about, well, reopening and what's the new normal. It's the reopening and it's the new normal. We have to also say part of the new normal is, yes, social distancing and changing how business models work. But part of the new normal has to be about how we address longstanding, persistent racial discrimination. We have to provide improve opportunity for young people at the initial part of their life, the middle part of their life, and the later part of the life. Those are the things that I'm going to be focusing on with the governor. It is really about, this is an opportunity to reset. And we have to take it. Otherwise, there's the old Fram oil filter commercial. Eric might remember this, but the old fellow who's going in to get his car checked, and the mechanic said, "You really should get your exchange your air filter." And the fellow said, basically, "I'm not really sure I want to do that." And the reply was, "Well, you can pay me now, you can pay me later." And we have another opportunity to pay forward and pay now.
Okay, so Eric, would you agree with William that this is not just about a response to COVID-19. It's an opportunity to talk about these very fundamentals related to restructuring the entire society?
Without a doubt. And I think that what is also important is what the governor of New Jersey is doing, and it's a powerful term called diversity. When you look at the response in America, you see a white male on the federal level, you see a white male on our statewide levels, you see a white male on our city level. We need diversity in a room that can bring not only their academic experience, but their knowledge of real time what's happening on the ground. And that revamping is in several different areas, something you don't hear anything about. COVID virus was supposed to be fought on two levels: intervention and prevention. We had an intervention plan for those who were in the hospital, how to deal with them, but we did not have a prevention plan, particularly among our seniors. We're continuing to feed our seniors food that is carrying out the pre-existing conditions. I've been an advocate that we need to change what government is feeding people, particularly in poorer communities. You can't continue to have a diet that really feeds pre-existing conditions. Over 94% of the people who died from COVID-19 had pre-existing conditions. We're continuing to feed the poorer parts of our country of those governmental surpluses that are really dangerous to your health. And part of the revamping and part of the conversation is, how do we change the American diet to become a healthier diet so that we don't continue to feed the crisis of chronic diseases in our country, particularly diabetes. Large number of people died of diabetes, and it's really killing our communities.
Yeah, obesity is seen as a disease of poverty these days. It's very expensive to be healthy. William, I'm going to give you 30 seconds, please, because we have to wrap up. Wrap us up, please.
Yeah. Well, as I said, another way of thinking about where we are, I think number one is we think of it in the context of, you have a young child, you have young children, right? They've gotten sick. American population has gotten sick. The public has gotten sick, right? Many states are starting to reopen. They need to make sure that that's the right thing to do. They have to make sure that if we send our children back to school, they're not going to either have a relapse or they're not going to infect and get their classmates and their teachers ill. Second, we need to basically fundamentally say to public policymakers, enough is enough. That we have to make these investments in human priorities, in education, in training, in our social insurance systems. Otherwise, not just African American communities, Latino communities, Asian communities, but all Americans, we're going to have more difficulty being a competitive country on this global stage.
William and Eric, I wish you both all the best with your good work on the ground. Thanks so much for joining us here on the Newsmakers.